we are going to be having two presentations for the Fletcher Afghan Evacuation Resettlement Working Group. The first of which is by Dr. Carrie Carlin. It will be on how to manage diabetes. And the second one will be presented by myself, Christian Jepson, on driving practices and laws in the United States. So first up, Dr. Carlin.
Hi, thank you, Christian. So yes, we're going to talk about some basics about diabetes today. And I'm Dr. Carrie. So the topics we will cover include what is diabetes? Why is treating diabetes important? What are the different types of diabetes? How is diabetes prevented? How can it be treated? And how do doctors test for diabetes? What is diabetes? Diabetes is a long-lasting condition that affects how your body turns food into energy. Food is turned into sugar by the body, and the sugar goes into the bloodstream. Something called insulin acts like a key to let the blood sugar into the cells where the body can use it as energy. In diabetes, the body does not have enough insulin, or the cells do not use insulin well. So too much sugar stays in the blood. Too much blood sugar. When sugar stays in the blood, the body cannot use it as energy. The extra sugar in the blood damages the body and can cause blindness, heart disease, kidney disease, loss of your feet and your legs. There are different types of diabetes that I will talk about. In type 1 diabetes, the body stops making insulin. There is also something called prediabetes that I'll talk about. In type 2 diabetes, the body doesn't use insulin well. And there's something called gestational diabetes, which is diabetes that happens in pregnant women. Type 1 diabetes. In this type of diabetes, the body stops making insulin. The symptoms can happen very quickly. Sudden weight loss, you can be very hungry and thirsty, or have a lot of urination and excessive drinking. It's often seen in younger people, like children. It's diagnosed with a blood test that tests the amount of sugar. It's treated with insulin shots every day, and the patient must see a doctor regularly. A proper diet is very important. Prediabetes is different. In this case, the body does not use insulin well. The sugar levels are higher than normal, but less than in type 2 diabetes. The risk factors for this are being overweight, being older than 45 years old, having family members with diabetes, and exercising less than 3 times per month. It's diagnosed with a blood test, and often people have no symptoms. It's very important to prevent prediabetes with a proper diet and exercise. Here's a diagram that talks a bit about prediabetes and type 2 diabetes.